evening to all. Today is the 11th research theme, and it continues with this terminology that we have been discussing, that is regarding allostatic load. So, we realized even yesterday that brain, which is a central organ of stress and adaptation, right? So when our body undergoes stress, the brain, which is part of the central nervous system, tries its level best to regulate or help us adapt to this stressful situation so that humans will not succumb in themselves to a negative or a disease eventful nature. So how does it regulate is by responding to the mediators of allostas, which are normally involved, but which, when dysregulated and if it is overused, lead to a wear and tear of the body. And that is when the body is said to be involved in allostatic load. So, this intervention to elevate the allostatic load can include improving the diet, promoting regular physical activity, or increasing access to support, and changing some policies of the in terms of the government or the private sector to improve quality of life, particularly for the disadvantaged. So, specific areas of the brain that show several forms of plasticity is involved in allostasis, and then they are affected by allostatic load and are implicated with related to vulnerability to chronic health conditions, right? And what are those regions that are contributing to this factor? The prefrontal cortex, the hippocampus, and the amygdala. So these brain areas are the ones which respond and which are the primary targets of preventive and interventional effects to reduce this public health burden of mental and physical illness. So the human brain considerable degree of plasticity and resilience. So that resilience is what we need to improve. So cognitive behavioral therapy also can be a changing mode to help alleviate even the depression and other mental health conditions. So, reduction in perceived stress also is positively correlated with disease in right basolateral amygdala, gray matter. So, because of that, also there's consistent with the reported ability of chronic stress to increase the dendritic branching in the basolateral amygdala. So, that is how brain, due to its plasticity nature, will undergo changes. So, if you improve that, there is a high chance for us to improve the mental health in terms of allostatic load. All right, so this is the study of McKevin 2010, which we were discussing for the last 2 to 3 days.